Okay, we're here with Dr. Rogan in Atlanta, Georgia. Dr. Rogan, you just experienced your very first NeuroCare treatment.
Yes, I did.
Can you tell us how you feel about that treatment? Let me put the camera down here. What's your impressions about NeuroCare, Doctor?
My impression after just a few weeks of studying it and going over information and talking about it with fellow colleagues, and then now seeing it in person and then seeing what it can do and how it can make you feel. The etiology of trying to rid the area of the affected injury with the edema fluid and trying to increase the flow and the circulation has been shown and demonstrated remarkably very well here. I'm very impressed with it. I see the potential of what it can do for people with disease processes. I've looked at the sheet revolving FDA-approved circulation issues and treatment protocols that can be used for this machine. I'm very excited about it. We'll be experiencing our first patient that's under my care tomorrow at a traumatic brain injury here in south part of Atlanta in Henry County area. And I'm excited and looking forward to working with it and working with Greg, Tom, as well as Mr. Elliott and Elliott Jr. And projecting good things for people who we're going to be involved with.
Doc, what kind of doctor are you?
I'm family practice and geriatrics.
Are you an MD?
Yes, sir.
Where'd you go to school?
I went to Meharry Medical College in Nashville and finished up my residency training at Morehouse and Emory at the Grady.
Two great schools, absolutely.
Yeah.
You had a treatment tonight. We found a muscle and spasm on your shoulder. We hooked up both of your shoulders. Now, only your left shoulder was pulsing. Did you find that interesting from a diagnostic standpoint, that we were able to identify edema and muscles in spasm?
Absolutely, and I feel real good right now. It feels good. It feels great. The stimulation was felt like somebody gave me a little massage initially, and and to witness myself feeling my muscles contract less on the left because of the edema and more so on the right. Where there was less so-called injury, it was great. It was remarkable.
Now we were able to relax the spasm. You had quite a bit knot here.
It was hard.
This is there's still a little bit there, but we softened it up quite a bit. You had a real tightness. What did you think about the foot treatment that we did?
Foot treatment, we saw it felt good. It felt real good when they put the electrodes in the areas for the circulation problem and the diabetic, maybe possibly. I'm not diabetic, but I had some edema around my ankles, probably from my socks and things.
We were even able to move some of that out. I noticed that your skin was tight. You've lost the hair around your ankle.
Yeah,
those are the early signs
of peripheral vascular
of circulatory problems. Okay,
exactly.
They lose the hair, then they get itching of the ankles, and then pretty soon their foot feels like it's on fire. Then you get this fluid buildup, and it's a vicious cycle. So it's a good time to start now.
Exactly.
And you can see the applications for patients for so many different applications. What did you think when you saw us hook up this young man's tricep over here?
That's Elliott
when we
Jr.
hooked up Elliott Jr.'s tricep and told him to try to bend his arm with all the strength of his bicep, and he could not do it. What was your impression?
It was great. I mean, to see it go from small up to increased stimulation to the point where it was great to show that when he could not.
Have you ever seen a muscle stimulator be able to overcome all the man's strength of his bicep, and he still couldn't close his arm? Have you ever seen anything like that before?
No.
Yeah. This is the world's most powerful muscle stimulator, 440 volts at very tiny milliamperages, and this is why we're able to do this. Now, you could do that with a DC output system. We did do this to him the other day. The problem is he couldn't take it. Yeah. Elliott, what did it feel like? We had both arms hooked up. One was a DC output on one arm. What did that feel like when it was being treated?
Electrocution. I felt like
and the other one,
Green Mile, dead man walking.
Yeah, it was a totally different experience. Well, gentlemen, thank you very much. Have a good evening. Dr. Rogan, thank you so much for your time.
It's been a pleasure. I'm excited about it. I'm looking forward to working with it, and I can see the potential. And in medicine, we want to do what we can do best for the patient. We've always been known to just prescribe pills, and that's what we do. I think that we always have to look for other different modalities to help improve patient care and outcome and stuff like that. And, that's what I basically went to school for, is just to look to what I can do to help the patient, and that's what I'm looking to do now. It's taken me a minute to really understand and learn, but I feel like I'm graduating just a little bit more.
Doctor, when you said tonight at dinner, you said if we can move out the edema, if we can improve blood circulation, the body can heal itself from all manner of diseases.
Right, exactly.
I thought that was very profound because if you boil down what we do with NeuroCare, we basically help the body function better. We identify edema, we can move it out. And edema, of course, is part of the inflammatory process, but you mentioned a lot of these major athletes, professional athletes that you hang around with the Hawks and other teams. You see a lot of swelling that they have from these are contact sports, even the NBA, as you well know.
Going up and down that court, jarring, that's an injury. That's like just really, that puts a lot of stress on the muscles and things.
And the banging under the boards.
It's like just going through a fight and all that quick movement and stuff. After that, I see no reason why they have to try to go through icing and stuff like that. I can see this be of great benefit in muscle recovery and system recovery, muscular, circulatory, neurovascular, everything on a person easily.
Yes,
very easy.
The sports applications of this are profound. You're going to get your major athletes back in the game. But in the workers' comp arena, what we have there is industrial athletes. And when they're off the court, just like the Celtics couldn't regain the title because Kevin Garnett wasn't on the court. Yeah. Okay. The same thing happens in business. Now, most businesses are using TENS units, electrical stim. They're using TENS electrical stim units, which are nothing but electrical analgesia, right? Transcutaneous electrical nerve stimulation, okay? In this case, we're not treating pain with this unit. We're actually getting to the causes of pain, which are the edema and the muscles in spasm, like what we did with your shoulders tonight. We identified that you had a muscle in spasm, and we relax the spasm. We're FDA cleared to do that. We're not approved. The FDA doesn't approve anything. They give us a 510K. In 1993, we got our first 510K. And we're FDA cleared and registered to provide all of these claims that you saw tonight that's on this sheet of paper. And this is the paper that goes through all the different applications. So, Doc, thanks so much for your time tonight. Appreciate your kind comments. We look forward to working with you.